Hello, this is Dr. Manis. I'll be talking about physician impairment and professional accountability. My objectives for this presentation are to review with you the definition and components of physician impairment, to discern for you situations and behaviors that may indicate physician impairment, and to help you determine accountability of medical students and physicians in addressing physician impairment. It's been estimated that at least 15% of physicians will have a condition at some point in their careers that impairs their ability to practice medicine safely. Some estimates put this number above 30%. Every physician has accountability regarding their knowledge or good faith belief that a colleague is impaired. Professionalism, as you know, includes regulation of self and peers. According to the Federation of State Medical Boards, the definition for physician impairment is the inability to practice medicine with reasonable skill and safety as a result of a mental disorder, a physical illness or condition, or a substance-related disorder. Responsibilities of physicians, and these are excerpted from American Osteopathic Association's Rules and Guidelines on Physicians' Professional Behavior, and chosen by me as those that I believe are most closely aligned with issues involving physician impairment. Of course, non-maleficence, do no harm, being our main ethical principle in medicine. In addition, other responsibilities: act as a positive role model, display respect in interactions with others, behave in a legal and ethical manner, participate in self-evaluation programs, and accept constructive criticism from others. The most frequent complaints filed with the Texas Medical Board about physicians are related to failure to reach standard of care and professional incompetence. They also involve things that are most closely aligned with physician impairment, such as unprofessional conduct which may endanger the public, and inability to practice medicine by reason of mental or physical impairment. Who is accountable for reporting or referring physician impairment? Well, of course, physicians in practice and physicians in training, whether they're licensed by the state of Texas when they're in training or not, if they have their medical degree and represent themselves as physicians. Also, medical students. This may come as a surprise, but there have been referrals made, as well as medical students involved in the reports about physician impairment. Accountability for this reporting comes from the Texas Medical Practice Act within the Texas Occupations Code. We have a duty to report physicians posing a continuing threat to the public welfare through the practice of medicine. I believe we also have an ethical obligation under the principle of non-maleficence to report impaired, incompetent, and unethical colleagues. This is stated by the American Medical Association, which is the largest peer organization in the world. The problems that lead to the complaints: sexual misconduct, drug or alcohol dependence, disruptive behavior, depression or other mood disorders, other psychiatric disorders, and stress or overwork. You will notice that these are also things that we talked about in physician boundary presentation. Red flags. These can indicate the presence of physician impairment. No one or even all together add up to physician impairment. However, they are warning signs: increased patient complaints, increased professional errors, increased conflicts with colleagues, increased emotional lability, increased appearing sleep deprived, although we have to put an asterisk by that one, and increased unexplained behaviors. Other red flags: lack of accessibility, like consistently showing up late for appointments or not responding to messages or other communications; decreased quality of care, decreased concern for patient welfare, and decreased personal hygiene, both things that we can find in physician burnout; and unpredictable behavior without excellent explanations. Physicians practicing in Texas who represent a risk to patient safety or public welfare, or who are suspected to represent a risk, can be referred to hospitals where they have privileges, Texas Medical Board, or Texas Physician Health Program. Now, hospitals have their own peer review committees, which could also have requirements for referral to the board and or to the program. The process with the board is after a signed complaint is filed, and these complaints can't be anonymous, they must be submitted in writing, but the complainants remain confidential, and that's by law. Are then referred to the board's investigations department. At the same time, a licensee receives written notice of a possible violation, and they get an invitation to discuss the case with the board. The case at some point could be resolved by agreement between the licensee and the board, or if there's no agreement or if there's an appeal, the case is referred to a judge with the State Office of Administrative Hearings. So what options are available to the board for violations of the Texas Occupations Code? The part that that's referred to as the Medical Practice Act. The board can issue written reprimands. It can place licensees on probation. It can impose other restrictions such as fines or limitations to practice setting or scope. It can require enrollment in the Texas Physician Health Program, or it can even revoke the licensee's ability to practice medicine. It's very interesting if you want to go to the Texas Medical Board's monthly bulletin, pick out any year and date and look for formal complaints and look for disciplinary actions. There are many examples and some very interesting stories that you can read about local or statewide physicians and their involvement with Texas Medical Board complaints and disciplinary actions. So the other place where licensees can be referred, the Texas Physicians Health Program, is a state board administratively attached to the Texas Medical Board and functioning in cooperation with the Texas Osteopathic Medical Association and the Texas Medical Association. Its mission is to protect the health of Texans and promote medical excellence by serving physicians and others affected by substance use disorders, physical illnesses and impairment, and/or psychiatric conditions. Contact with the program can be made for assistance and guidance, suspected impairment, or concern for the safety of physicians or other participating health professionals or their patients. Referrals are accepted from anyone and are kept strictly confidential. There are also self-report forms available for substance abuse disorders and for other conditions. When Texas Physician Health Program participants apply or renew their state license, they respond yes to the question of whether there is an existing impairment, and note that they are involved in the Texas Physician Health Program. The program will notify upon request the Texas Medical Board of their involvement, but will not release further records without the licensee's written consent. Referrals for physicians, though, are not accepted in certain circumstances, and I want to stress these. If a physician has committed a standard of care violation as a result of drugs or alcohol, if the physician has committed a boundary violation with a patient or a patient's family, if the physician has been convicted of or placed on deferred adjudication or community supervision for any of a long list of violations, or of course if they're not licensed in Texas, if they're eligible to be licensed, they are not accepted. So that last, if they're not licensed in Texas but not eligible, would mean medical students. So medical students are accepted under this referral. However, if the student, resident, or practicing physician has committed or been convicted of any of the other items, they're not accepted. So to me, this makes it a critical point that referrals to the physician health program have got to be made as soon as possible. When there's a suspicion, when there is even the smallest amount of evidence, the earlier a referral, the better. No one suffers from a referral that is not accepted from a lack of evidence or need. The program contacts the licensee, the physician or resident or student, and if that person accepts the help, then it's available. If they don't, it's kind of no harm, no foul, nothing's reported. However, if further problems ensue, then that actually does not bode as well for the physician when they talk to the judge about what went down. So the program provides education, recognition, and assistance in diagnosis and treatment for its participants, and this includes acute and ongoing treatment as well as appropriate monitoring and follow-up. It's a very useful program. It can require, though, abstinence and submission of, say, urine drug screens, attendance at self-help groups, and treatment follow-up. It can even include consent for communication with family or significant others, and it can be transferred, must be transferred, to appropriate state programs or licensure boards when physicians relocate. So in summary, physicians and medical students have accountability to society, peers, and patients in reporting physicians who present a risk to public welfare, including to patient safety. When that risk appears to be due to physician impairment, physicians practicing in Texas can be confidentially referred to hospitals where they have privileges, to the Texas Medical Board, or to the Texas Physician Health Program. Following are some references. I'd like to reinforce the importance of referral and reporting. This can be done at any time and confidentially. Hard to find any practicing physician who hasn't been involved, at least in referral or support of a colleague that's been referred. So if you have any questions, comments, concerns, please let me know. Otherwise, there's additional information on Blackboard under session CM1.36. Thank you for your attention.